the floor is yours. Thank you for being here, Dr. Rebecca McGowan.
Great. Can you hear me okay now?
We can hear you.
Well, thanks everyone for joining in. So I'm part of a national men's health program that's been going for 5 years. Started originally in northeast Victoria. It's called Prick and a Pint. It's loosely based on a book club model, with the idea being that we have small groups of men, about 15 to 20 men. They meet once a month on the same Wednesday, the third Wednesday of every month, and they meet in a private room in their local pub. And they have a GP who talks to them. Each session's a different topic, such as cardiovascular, diabetes, the groin, mental health, and we teach men how to engage with the health system. It works very well because we all know from the National Men's Health Survey in 2018 that approximately 1 in 2 men have a long-term chronic health issue, and almost 1 out of every 2 males in Australia have had or do suffer from a mental health illness. I've been a GP for over 3 decades, and I know that sitting in my ivory tower waiting for the men to come in or to be dragged in by their partner doesn't really work with engaging men. So along with 3 other men in my area, we set this up, the Prick and a Pint. So the idea is that a man gets they can log on online to their particular group. They take a letter to their GP. They get baseline bloods, baseline body readings such as blood pressure, waist measurement, height, and then they bring it back and we have the test results in front of them, such as their cholesterol or their blood glucose level or their blood pressure. And we teach the men what good looks like or what bad looks like. So one of our, in terms of going back to that previous diagram, we like to think that we tick all of those 15 boxes. So we engage the men where the men are. We go to the pub, Muhammad to the mountain, or the mountain to Muhammad, fish where the fish are. So it's not a threatening environment for men. Normally when they walk in, they normally know 1 or 2 other people. It's the same group of men over the 10 sessions. And it's a very accepting, welcoming environment. The pubs love it because the pubs love getting men back in. There's no pressure to drink. We have non-alcohol drinks, but normally the pub will shout the men a pint of beer at the end of the 1-hour session. So our premise is that we basically get the men back as the driver for their health, teaching them, again, as I said, what good looks like, what bad looks like. It's very respectful. There's a lot of humour. There's a lot of time for questioning. And we know over the 4 years, we've been involved with research with Melbourne Uni. We do an entrance survey, we do an exit survey, and we're very proud to say that we're definitely seeing changes in men's life. And men say that they use a lot of our information on a daily basis. And as a GP, I've got a very strong focus on prevention. So we teach men about exercise, sleep, nutrition. We teach them the importance of family history, and we teach them about mental health. And with these practical tools, as I said, the men really can use them, and we're very heartened to see, even 3-4 years down the track, we're still seeing men who've made huge difference to their lives based on the information that we've been able to give them. So I'm happy if people want to ask me questions about the program.
Yeah, great. So anyone got any? Thank you, Rebecca, for that oversight. You can see within just in that little conversation how much of what we've already been talking about is sort of built into your model. Obviously, a male-friendly setting, going where men already are, the pub. Later on, we'll be talking about the value of building community. We've talked about humour and language. So, anyone want to pick up? Anyone got any specific questions for Rebecca or comments on this particular program? So again, go to the participants box and raise a hand if you can, or type some questions. So yeah, just a quick question from Josh. Is there a website? Great idea. We'll post a link to the website there for you. In a moment, it's there, it's done. I know, yeah, there's a link. So, I mean, quick question from me, something that's come, I've mentioned your project a few times in the past couple of weeks, because something I've wanted to do for a good while is I'm really interested in bringing together people who are using similar settings to engage with men in different ways. So on Tuesday, we had a whole session on different projects using sport as a setting. But I really want to do one on organizations using pubs and as a setting. Then obviously there's like on Wednesday, we did a whole session on alcohol and risky drinking and the sort of the male risky drinking culture. So is it ethical to be doing health in pubs? Is, I suppose, the question. Do you get any pushback on that? I mean, you must have been asked something like that before.
Yes,
Yeah,
we do. We get a lot of feedback on that. And we say, well, it is ethical because we're not going to go to a library for the men. And our big message is promoting healthy drinking. So we do a lot around healthy drinking. And there's quite a few men who have, lemon, lime and soda, or they just have, non-alcoholic drink. We actually get quite a few of the pubs that we work with to actually stock non-alcoholic beer. And it works very well. As I said, we're not going to go in a park and give people coffee. We just know that won't work. So we take it on the chin, and we have had a fair bit of flack. Why are you going into a pub? But as I said, we can point to our results where we actually show men reduce their drinking. And we've had quite a few men who've actually stopped drinking altogether. And we do the suck it and see. We say, how about you go off alcohol for a month? How about you go off it for 6 months? So we can actually prove with our data that we reduce men's alcohol intake. And we're very proud of that.
That's fantastic. Yeah. A couple of examples. We've got Beer and Bubs that does, this is to speak to your point earlier about engaging with fathers. Beer and Bubs prenatal classes. We've got and bereavement. You may know, Kate Obst, there's bereavement in a bar in Victoria. So because bereavement services are mostly reaching women, and there's at least one bereavement group which is called bereavement in a bar. So we've got a few examples of projects effectively using pub settings to responsibly engage with men. And I think that's the key thing. It's about using those settings responsibly, because like Rebecca said, you can go and deliver it in a library if you like and be super ethical, but you'll find you'll only get one bloke showing up. So what's more effective? Going into a pub where you get 20 blokes, or going to a library where you get one bloke? How scalable is this program, Rebecca?
Well, that's a really good question. So it has been reliant on a GP. So we have one GP who will present to the 15, 20 men. Now it's volunteer at the moment. We're about to do, and I've just put it on the chat, we're about to do our first national one, because we have like 2 or 3 men in Adelaide, 2 or 3 men in Wollongong, Tasmania, and we haven't been able to get a group up and running in some of those areas because it is problematic to get the GP. Right. So like a lot of us, COVID has actually brought us kicking and screaming into the 21st century. So we're using COVID, and we're starting, we're using it exactly what we're doing now, that a lot more people are used to Zoom and IT. So we're going to start our first national program on the 15th of July. For those of you who've ever been to Beechworth in northeast Victoria, that's where we started. And there's a very iconic old pub in the centre of town called Tanswell's. And a lot of you will know Bridge Road Brewery, the one that's based in... they've got the Ned Kelly, really good pale ale, if anyone's interested in pale ale. So that's the Beechworth Brewery, and they're going to make us their own little tin, Prick and a Pint. So we're going to have our national one starting on the 15th of July. Any of you can join. So I'm going to be presenting to the 15, 20 men, and then we're going to have Zoom access all across Australia where people can join it. So we're upscaling now because we can. And we're hoping to have a couple of hundred people joining that via Zoom. And that will be for 6 sessions. People can go online to our Prick and a Pint website and join. They get the pro forma letter that then they take to their GP. They get their results in front of them, and then they can follow our program for the 6 sessions. So we're going to be doing that from July through to November, once a month.
That's great. Terry Cornick and Mr. Perfect, a really interesting comment there, but do you want to say it out loud, what you've just shared?
Hey guys, yeah, I just came in on that. I thought I was hooked as I was listening to it. So in a nutshell, we run community barbecues across Australia. We've never had alcohol at the barbecues. We don't specifically say um, don't bring it, don't have it, but we kind of allude to the fact that we'll provide soft drinks, and it's kind of a unwritten rule that happens. One, because some of them are early, some of them are breakfast barbecues, some of them are we don't want to promote that too much overtly. However, we're also aware that some of the people that access our services may have had alcohol addiction problems in the past as well, or the issue we have is sort of culturally the idea that you go to a barbecue and bring a six pack and everything else. Some people used to think that when we didn't make it as clear what the barbecue was about before we kind of got our communications really together. They just assumed, oh yeah, I'll just bring some drink and do. So it's this very fine line for us being non-clinical, kind of suggesting that look, alcohol's fine. We're definitely not against it. We have our board meetings in a pub sometimes. It's not. We started Mr. Perfect because I told my mates over a couple of beers, it gave me the courage to go, let's have this deep discussion on my struggles. And then they opened up to me and away we went. So it's always been a really interesting discussion for us, a really positive one. And we could talk for 2 hours straight about it. Me, our board, people involved in Mr. Perfect. Some people are really pro it. A couple of people are really against. A lot of people are right in the middle, and they understand that it can make a really comfortable discussion for men. So yeah, it's very complex, but it's an interesting discussion always.
Great, thanks, Terry, and you're joining us in the next session. So that's also been an excellent sound check as well. Thanks for that. So we're coming up to the end of Rebecca's time. Does anyone else want to jump in and share anything or reflect back on what they've heard? Who'd like to see one of these in their local pub, for example? Anyone's welcome to jump in. And we've got a comment from Godfrey. The pub is not the problem. It's how we use the alcohol in the pub that can be the issue.
Yeah, I'll jump in because
Thanks,
again, it's a great project, Rebecca. I think it's fantastic what you're doing, and I think we went through this earlier in the week. Men's health night started in this country in a pub somewhere in Victoria many moons ago. That's how this whole sector began, was getting men together in a rural location in Victoria to chat with a few doctors. So I do a lot of work in pubs and clubs. I think it's great. It is hard if you work for the government. If you work for a government health department and you're trying to organise something, they have rules where, no, you don't go into hotels. But if you're with an NGO, you can partner with a government worker and you can do it that way. So it's great. Thank you. I think it's good.
Right. And thanks, Greg. Comment from, Rebecca, go ahead.
I was just going to say, coming back to your question, how upscalable is it? We're also actually now going into corporate. So we've had 2 corporate programs that have worked really well, and that's been engaging with so-called blue-collar workers, shift workers, so factory workers. So we've gone in on a Friday afternoon when a morning shift's changing over to an afternoon shift, and we've actually brought in no alcohol beer, so to replicate the feel. So that's worked really well. We're also about to start a corporate program for women along the same lines, and it's called Boobs and Bubbles. So we're going to be, and again, the bubbles won't necessarily be champagne, it'll be soda water. So we expect to cop the same thing, like why you're bringing alcohol in, but we're saying bubbles is soda water as well. So it's just the vibe of the thing. So the corporate program is very upscalable, and that's one of my carrots that I've been dangling for the GPs, because it's quite hard to get GPs to come out and talk for 2 hours once a month, because it used to being paid. And it has been a bit of an indictment on my profession, because I'm so passionate about the men's health, and some of the questions I've got from GPs is, well, how much do I get paid? And we say, well, it's a volunteer program, but if you've done a few volunteer sessions in the pubs, then there will be the corporate jobs. And the corporate jobs are about $5,000 for an afternoon's work, or $5,000, for 6 sessions. So that's been a bit of a carrot for us to help get GPs on board, that we say, once you've done the volunteer program, then you can take it to your corporates. So that's working quite well, because then we can feed that money back into our program as well. And we're hoping to get an app. So we're going to get an app. We're after about $600,000 to $800,000, and we've been working on funding for it for the last 4 or 5 years. And we've got some, we've always got irons in the fire, but that's what we're planning to do. So word of mouth, we're going to do a lot of media on it, and people can hear Prick and a Pint. The women often, female partners will push their men into it, and they'll hear about it and they'll say, look, we've heard about this program, you go and do it. So we're right at the crest where we're about to, go big or go home, and that'll take the funding for the app. So we're hoping to get very big, and no one's heard of us, and that's deliberate because we haven't done a lot of advertising because we haven't got the app, but we're hoping in 2-3 years' time, everyone will have heard of us. We want to get as big as Beyond Blue, really. That's our aim.
That's great. Thanks, Rebecca. A couple of comments here. One from Stuart in Men's Sheds. Actually, Stuart, do you want to just share what you've shared in the chat box? Are you there? Okay, I'll share it for you.
No, sorry, Glenn. I couldn't turn my microphone on. Well, what Dr. Rebecca McGowan was saying resonated with me. I went down the the Wagga Men's Shed, and they took me round the back of one of the sheds, and they said with great pride, "This is our brew room." We started off with alcoholic ginger beer, and some of our members just were dead set against it. What about alcoholism? What about this, that, and the other? And as the guys were chatting in the shed, it occurred to me that this was as good a place to chat as the workbench in the other room. And they had this joint focus on a particular project, on a particular activity, and that opened the door and gave them permission to talk about anything else. And I'm sure Dr. McGowan has come across exactly the same thing as she watches these guys interact over a pint. I see there's no wrong as long as someone doesn't take it too far. Thanks, Stu.
Yeah, thanks, Stu. And Josh Tree, are you able to open your mic? Because I'm interested to hear about the couple of things that you've been doing using bars in your area.
Hey Glenn, how you going?
I'm good. And Greg, I'm going to nip out for a second. So if you could just take my seat, and I'll be back in a moment. Thanks. Over to you, Josh.
I think what Glenn's referring to is a program that we started a few months back called Barstool Blokes. So it was really stemmed on having open conversations around men's mental health, but in a barroom setting, with essentially burgers and beers and that sort of stuff. And what we're seeing with that is a lot of frank and open conversations there. There's the option for guys to play it forward for another book when they turn up. Obviously, what we also do is make sure there's funding there to supply a burger and a beverage. It doesn't have to be that they drink beer or anything like that. They've got the option for that. But the main thing is really that we just wanted to create an environment and culture for guys to get in a group, meet new people and break that social isolation that comes about. Sometimes obviously with blokes and being someone from a clinical background, I guess like Rebecca as an exercise physiologist, we're just trying to create different versions of supports in the settings where blokes turn up and could be just them shooting the breeze about sport and leading into a more frank and open conversation. And we do actually organise speakers once a month to come in on a key topic. That's it in a nutshell. But great idea, Rebecca. I'd love to have a chat to you about how we could implement that program down in Illawarra and southern West Sydney, where I'm based, and I've got that network of GPs to be able to leverage off.
Great, thanks, Joshua.
So we've gone over time. We're only a little bit behind time. We've got a tight schedule today. So any last words you want to say before we bid you farewell, Rebecca?
Now, look, if anyone's interested, log on to our Prick and a Pint website, have a look, and feel free to connect with me via LinkedIn.
Perfect. Thanks
Yeah.
so much. It's been fantastic. We've been in contact for a while now, but it's the first time we've had the opportunity to get you into one of our meetings.
Yeah.
So really appreciate you giving your time today and sharing the excellent work that you're doing, Rebecca. We look forward to following its progress and being right there behind you as you become bigger than Beyond Blue.
Yeah, we hope so. Great. Thanks, everyone. Bye-bye.
Thanks, Rebecca.